And as drastic measures are taken across the world to combat COVID, here in the U.S., the number of COVID cases continuing to climb.
Yeah, the U.S. actually surpassed 71 million reported coronavirus cases as of yesterday. Meanwhile, more than 872,000 deaths have been reported since the start of this pandemic. Now, it all comes as the Omicron variant of the coronavirus continues to spread across our country. Joining us now to talk about it is Dr. Dominic Lucia, the Chief Medical Officer of McLean Children's Hospital. Dr. Lucia, thank you again for joining us here. Appreciate it.
Thanks for having me.
Yep, and as the number of cases continue to rise, I guess the big question right out of the gates here, what is the best and most convenient way to get tested by Baylor Scott & White?
Yeah, well, first of all, there's other avenues other than Baylor Scott & White to get tests. You can order tests from the government at covidtest.gov. We would also suggest you call 211 to find out the closest testing center. Using Baylor Scott & White, we'd encourage those that are going to use that route to use the urgent care centers, possibly the clinics, but to save the emergency department for those that are really ill and not just for testing right now.
Definitely. Dr. Lucia, for those people who are vaccinated, we know a lot of folks are out there getting boosters. So how exactly does the booster protect vaccinated people?
Yeah, we've seen the boosters really work well with Omicron. So the first 2 doses worked quite well with the other waves, the other variants. What we've seen with Omicron is the 2 doses didn't work quite as well. They were good, but not great. And what we found, and more recently in a multi-center study that Baylor Scott & White was very proud to be a part of and published by the CDC recently, is that that booster is so important in presenting not only visits to the ED or urgent care for COVID symptoms with Omicron, but also preventing hospitalizations. So if you haven't gotten that booster within the last 180 days, I would encourage you to go do it. It's the best way to keep yourself safe and out of the hospital.
Okay, doctor, from a shot to a pill, this one's got a lot of people excited. COVID pills will soon become another option. Are they going to transform, do you think, how we treat people for COVID? And will they be approved for pediatric patients, the young patients that you guys see?
Yeah, we're really excited about this too. I think the collective of medicine is the idea to have a pill that would be able to keep a high-risk patient out of the hospital is really great. The early research trials and data showed some very, very promising results, and we know that those are being rolled out to communities nationwide. So a couple things about the pill that we need to know. One is the availability has been limited right now with limited supply chain. There's been some issues with that, so I know the local pharmacies some days have them, some days don't. So that's an initial issue, and hopefully that will get better as the weeks go along. Second of all, right now it is approved for ages 12 and up, but it has to be in particular patients. It has to be in those that are high risk for progression of disease, those that have a positive test, of course, those that have had symptoms for less than or equal to 5 days. And if those criteria are met and they're able to get those pills and take them, we think that it's really going to help keep folks out of the hospital.
All right. Yeah, hopefully we can get on the backside of this pandemic. Dr. Dominic Lucia, we always appreciate your time. Great words of wisdom today. Thank you.
Thanks.